So we're very pleased to have with us today our speaker, Mike Altman, who is a benefits advisor. Mike has been, you might recognize him because he was at our library last year talking about Medicare the same time of year. We were really pleased to have him at our library, and so we're really pleased to have him back in this online version. Once Mike starts, I'm going to turn off my camera, and then you'll hear Mike's presentation, and then we will take questions at the end, and you can put them in the chat. So welcome, Mike.
Thank you very much. It's great to be here again.
Thank you for joining us. I'm going to turn off my camera now, and I'm going to turn things over to you.
Terrific. Well, good afternoon, everybody, and welcome. This is a much appreciated you're joining us. This is an educational seminar on Medicare. My goal is always to take the mystery out of Medicare, because when you look at all the different options that are available to you, it becomes very confusing. And that's where I come in to try to help resolve that. In terms of a little background about myself, I've been in the healthcare industry for 48 years. Most of that time has been spent working with large companies, helping them decide what benefits to offer to their employees. Well, when I turned 65 7 years ago, I decided that there's even a greater need for seniors who are either turning 65 or who are already in Medicare, and better understanding what their benefits are, the different options, because the most important thing is you don't want to put your finances at risk. And you want to make a decision that you are comfortable with. I typically do these sessions at libraries throughout the area. I kind of miss those days where I could be doing it in front of a live audience where I can see them. But unfortunately, COVID kind of acted as a breakup on that. So I think we're doing the next best thing. And we're going to go through my presentation. And again, Roz has mentioned, there can be questions at the end, and at the very end of the presentation, I'm going to give you my phone number and email address in case somebody wants to talk to me on a one-on-one basis. For those of you who may not be aware, 10,000 people turn 65 every day. That's an incredible number. A lot of baby boomers are doing that. And Medicare can be confusing. But again, I'm going to talk to you about the basics, so hopefully this will make more sense. In terms of getting onto Medicare, there's really three ways of doing it. As soon as you turn age 65, you are eligible for Medicare, at least Part A, which is for hospitalization, skilled nursing care, home health care, and hospice. So again, hospitalization, skilled nursing care, hospice, and home health care. Typically, there is no charge for Part A because you have been paying for it. You've earned it because you pay taxes on this. So Part A for most people is free. Another category of people who can qualify for Medicare, if you're younger than age 65, but you have a qualifying disability and have received at least 24 months of disability checks, you are eligible to enroll in Medicare. One other situation, at any age, if you have a diagnosis of end-stage renal disease or ALS, you can be eligible for Medicare. Now, there are two pieces to Medicare. I mentioned Part A. Well, there's also a Part B. Part B is for physician services and also outpatient care. Now, there is a monthly charge for Part B. With Part B, there is currently a $198 annual deductible, again, for physician services and outpatient care. In addition to that, there is a monthly fee. The basic fee or standard fee that most people are paying is $144.60 per month for Part B. Now, some people may pay a higher rate because the government looks at your last 2 years of your adjusted gross income. And if you're over $87,000, if you file an individual return, or $174,000 for a joint return, the government can charge an additional amount of money. It's called IRMA. And next year it's going to go up slightly, where for an individual filing an individual tax return, it's going to be $88,000, and for a husband and wife who are filing a joint return, it's going to be $176,000. Now, the thing to keep in mind too is that your circumstances can change over time. So that in the future, if your income has changed dramatically because you've left the workforce, for example, you can be eligible to have that additional amount of money called IRMA to be stopped. You would then have to just appeal the decision to Social Security and share with them what your current situation is, and then they can decide whether or not your additional amount of money will still continue to be charged, or whether or not that will be waived. In my own case, I was charged initially when I went on Medicare, but again, my circumstances changed, so I was able to get that removed. Part A, again, the hospital-related cost, that will always be the first of your birthday month. So if you were born July 30th, for example, your effective date is going to be July 1st, the year that you became age 65. Part B, which is for physician services, you determine when you want Part B to begin because there is a charge for it. One of the things too, if you are still working, you're past age 65, I think it's important for you to ask your employer, the HR department, whether or not they will still cover you on the group employer plan, even though you've reached age 65. You're going to find some employers will allow that, some employers will not. The other question to ask them is, do you need to sign up for just Part A to be on that plan? Or do you need Part A and Part B to participate in the group employer plan? But it's very important to ask that question. Typically with large employers, all you're going to need is Part A. Smaller employers, sometimes you need Part A and Part B. But again, the questions need to be asked so that you'll have an idea of what you need to do. In terms of enrollment into Medicare, it can be done right online at medicare.gov. At medicare.gov, one of the documents you should try to get your hands on, it's a book called Medicare and You, 2020. Every year they come out with a new version of it. You can download it to your desktop and have it as a resource. Don't print it out, it's very long. So if you have it, that way you have another resource in addition to the booklet that you're going to be getting once we are completed with the seminar, so that you have some good reference points. Medicare is incredible. It picks up Part A and Part B. It picks up 80% of your eligible expenses. Wow, that's pretty good. And I'm going to share with you a personal experience. 4.5 years ago, major surgery. I had a bill of $690,000. I've never paid a penny because of Medicare. The neat thing with Medicare is that it's first dollar coverage, and it's just great benefits, covering such things as colonoscopies, mammograms, your flu shots. It's just an extremely well thought out program for seniors. Many times I find seniors who are just afraid to go into a government program. don't be afraid. It's great coverage. And typically it's much better coverage than you had even as under an employer plan. And certainly I can do comparisons for you between what you currently have and what Medicare can offer you as well. I mentioned that Medicare picks up 80% of your eligible charges. Well, what about the remaining 20%? Well, that's why people who have a supplement plan to Medicare. And a supplement plan is going to cover that remaining 20% of eligible expenses. It'll also pick up any Medicare deductible, that will be covered as well. And then with Medicare and having a supplement plan, you're really looking at 100% coverage. Many of you have probably been in an HMO or a PPO, preferred provider organization, or again, an HMO. A supplement plan is quite different. There is no such thing as in-network or out-of-network. Under a supplement plan, you can go to any provider anywhere in the country as long as they accept Medicare. So you don't have to be concerned whether they're in a network or out of the network. All you do is simply make an appointment with the provider and you have the service done. 95% of all providers around the country, they accept Medicare. We're snowbirds during the winter time. We go to Arizona normally. I have doctors there. I use Mayo Clinic. So it opens up a whole new world for you so that you don't need to be concerned about, is my provider in the network or out of the network? Okay. So I wanted to also talk about enrollment as well. Again, as I indicated, Part A, you can enroll in that 3 months prior to the month that you are turning 65. 3 months prior to the month that you turn 65. It will always be that. So the month that you turn 65, resorting back to the first of that month that you turn 65. That will not change. That is going to be done automatically. Part B, you don't, for most people who want to go to Medicare, they typically don't have to do Part B until they're ready to retire and move off the employer program. But again, you should ask your employer through the HR department whether or not you have to have Part A or Part A and Part B in order to remain on the group employer plan. Very important to do that. Medicare, as I mentioned, covers so many things, but there are some items that are not covered, like dental, like vision care. Medicare also does not pick up your prescription drug coverage. That's why most people have a Part D to go along with their supplement plan, and Part A and Part B. And if I haven't mentioned it, you have to be in Part A and Part B in order to enroll in any supplement plan. For a prescription drug plan, as long as you have either A or B, you can enroll in a prescription drug plan. Now, Part D was set up in 2006 under the Bush administration. It was designed to help seniors with their pharmaceutical costs, the medication costs of their drugs. So most people have Part A, Part B, a supplement plan, and also a prescription drug plan to go along with that. So it kind of matches many of the services that they may have had under the employer plan. But again, with a supplement plan, there are no co-pays for office visits. You decide who you want to go see as a provider, and as long as they accept Medicare, you are covered. It's first dollar coverage. There is no out-of-pocket maximum. There are a couple of different plans out there that you can enroll in. Most people are in a Plan G or a Plan N. Plan G has the highest level of benefits that you can possibly have. Prior to current times, there used to be a Plan F. Well, that went away the beginning of the year. Unless you had Part F already, you could then be grandfathered in to keep it. What happened was that insurance companies finally woke up and said, you know what, we don't want to keep paying this annual deductible, currently at $198. We'd rather have a different approach, have the responsibility go to the person signing up, and we'll reduce the costs. So Part G right now, or Plan G, Plan G, that is the highest level of benefits that you can possibly have. Now, the rate for a Plan G is much lower than you would have expected with a Plan F. Let me give you an example. My wife had been in Plan F. I moved her to Plan G. We were saving $30 a month as a result of doing that. Well, 30 times 12 is $360. Subtract $198 from that, and I still had just under $200 in my pocket rather than the insurance company. Also with Plan G, increases from year to year are much less than they used to be with a Plan F, just because of the deductible being paid by you. You're responsible for that. One of the other things that we see is that Plan G has lower increases from year to year than we also saw with Plan F. Many insurance companies offer a supplement plan. Again, Part A and Part B are offered by the government, nothing to do with insurance companies. But your supplement plan, prescription drug plans, those are offered by insurance companies. If you're looking at a Plan G, which most people have today, the benefits are the same, irregardless of what insurance company you're looking at. So whether it's Blue Cross or Aetna, Cigna, whatever the case may be, if they have a Plan G, it is going to be identical. The thing that is different is how much do they charge for it? Many people have questions saying, well, wait a minute. If you're telling me the benefits are the same, how come the prices are different? It's really no different than if you need to buy eggs or get milk. You can go to Mariano's, you can go to Jewel. It's still either eggs or milk, but they're going to be charging a different price for it. Well, healthcare is no different. So it really becomes more of an economic decision as to which plan do I want to go with. And that's where I come in. I do all the legwork for you in terms of looking at the different alternatives. Again, because I represent so many different insurance companies, I like my clients to be able to look at options. It's an important aspect of it. You want to make sure that your decision is going to meet your needs, and that's where I help people. By the way, there is no charge for my services. Let me repeat that. There is no charge for my services. When I enroll somebody in a plan, I get a commission from an insurance company. Commissions are typically the same for every insurance company. So I work for my client to make sure that whatever they decide to do, they're not putting their finances at risk, and they're making a very solid decision that they're going to be satisfied with. So I work closely with all of my clients. One of the things that is coming up, for those of you who are on Medicare already, the annual enrollment period is coming up. Every year it runs October 15th to December the 7th for a January 1st, 2021 effective date. It is during this period of time that if you wanted to make a change with your prescription drug plan, insurance company, or your supplement plan, you're allowed to make a change. And that's where, for most people that do what I do, it's a very, very busy time, because typically my clients like to look at options, and that's what I'm presenting. It's really no different than looking on an annual basis at your homeowners or your auto insurance. You want to make sure that those plans are still working for you. Well, healthcare should be treated should not be treated anywhere different. It's important to review it. It's important to work with your agent, if you will, to make sure that your program makes sense still, that you're getting the best arrangement that's going to meet your needs. There is one other part that I do want to talk to you about. It's called it's called Plan C. It's called a Medicare Advantage plan. And I'm sure you've all been bombarded with commercials on television, radio, on Medicare Advantage plans. And they're offered by many insurance companies. And I also offer that as an opportunity for people to enroll in. The thing with a Medicare Advantage plan is that you're really tied to a network. If you're in an HMO Medicare Advantage plan, you have to use their providers. You have to stay within the network. Otherwise, there's no benefits unless it's a medical emergency. With a PPO Medicare Advantage plan, then you're back to network or out of network. The way those Medicare Advantage plans are set up, there's typically no monthly charge. Now, on the onset, that sounds extremely inviting. No monthly charge. But what does happen, just so you should know, they're set up so that for every type of procedure that you may be having during the year, you are going to have a copay. For example, you might pay $300 a day for every day that you're in the hospital. Hospital costs may be paid at only 35% in the network and much lower than if it's out of network. So that's one of the major differences. With a Medicare Advantage plan, you are tied somewhat to a network. An HMO is more restrictive than a PPO. And a supplement plan is much more flexible than either of those two. It just depends on how you want your health care delivered. A Medicare Advantage plan are excellent plans, but they're not for everyone. For people who do a lot of traveling, for example, they may go away during the winter time. A Medicare Advantage may not be the best solution for you. So those are the things that when I sit down with my clients, I talk about Medicare Advantage plans. I also talk about supplement plans. I also can offer dental and vision plans. So it's a fully function of being able to provide all the different services that one needs to make sure that they have adequate coverage. I even do travel insurance. However, that market has been rather slow of late. I'm hoping that that's going to improve. This may be a good time just to, before we go any further, just to give you my email address and my phone number. My phone number is 224-999-3696. I live in Lincolnshire, for example. And the library is my library as well. My email is Mike Altman, MikeAltman @hotmail.com. What I'd like to suggest and what I'm really offering is the opportunity that if you would like to take a look at other options and you're already covered by Medicare, if you can provide me with certain information, such as your date of birth, your zip code, whether you're a smoker or non-smoker, and a list of any of your medications, along with the dosage and frequency. And again, the annual enrollment period is coming up just a couple of weeks from now. I can do an analysis for you, and we'll review it together so that you can decide whether, maybe a change is warranted, or maybe I'm just as well off by staying where I'm at. The choice is always yours. I do not do any hard selling at all. My goal is to make sure that people, again, make the right decision for themselves, and to kind of get through all the gobbledygook of options that are available, and to really look at ones in which not only are they going to have great coverage, but they're going to have very good customer care as well, which is a very important item to me, because that's how I want to be treated by companies that I work with. No different from my clients. I do newsletters every 2 weeks, every 2 months, I should say, regarding Medicare and changes that are occurring. In fact, I just released another newsletter just last week regarding the changes in Medicare, and also the fact that an annual enrollment time is coming up as well. So that's really kind of my story. I'm really here to help people. The majority of my clients, they come to me by referral because they've been very pleased with their working with me. And I would encourage you to take advantage of that as well. You've got nothing to lose. It's not going to cost you anything to look at other alternatives. And that's what I can bring to the table for you. One of the other items I do want to mention, this booklet that Roz is going to send to you, it's an excellent book about learning the basics of Medicare. Again, because it can become so confusing out there. And it's kind of designed to take the mystery out of it. So with that, I'm going to turn this back to Roz. If you have any questions that you want to put in the chat room, that would be great. Roz is going to read them to me. And if you'd like to talk to me on a one-on-one basis, again, my number is 224-999-3696, or Mike Altman at hotmail.com. Thank you, Mike, for joining us today.
Yeah, thank you for that overview. We do have some questions already. I'm going to feed them to you, and you can tell us what you think. There's someone, she says, I'm currently on my husband's insurance at work. He's planning on retiring next year, but not sure which month yet. When he does leave his job, it could be within a month's notice. When he and I apply for Medicare, how soon can coverage start for both of us? Can we apply, say, in February and be covered by March 1st?
Absolutely. Again, your Part A will always be the month that you turn 65. So that's a given. Your Part B, you decide when you want that to be effective. The idea is to have continuous coverage so that when your employer coverage ends, your Medicare coverage begins on the first of the next month. So in getting back to your example, absolutely, that's not a problem. And again, you can go to medicare.gov and you can sign up for Part A and Part B. Now, sometimes for Part B, the physician piece to it, Social Security will require you and your husband, in this case, there's a form that they can get from the employer. It indicates that you have credible insurance and also the fact that you are leaving group coverage. Most times you're going to be asked to provide that. I have the form in case your employer says, we have no idea what you're talking about. I can help you with that. It's very, very simple. Hopefully that would have answered your question.
Yeah, okay, let's see. We have another question. Somebody wants to know, is Plan G the same as supplemental insurance? Is Plan G what covers dental, vision, and prescription? And how far in advance of retirement should you start looking at Part G coverage?
I think I heard 4 questions in there.
Yeah. Yeah.
Well, first of all, Plan G is only available in a supplement plan. There are other plans as well, but if you're looking for a plan that has the highest level of benefits, it's going to be Plan G. What you're referring to is a plan with dental and additional benefits. then you're really talking about a Medicare Advantage plan, because dental, preventive dental may be covered depending on the insurance company. Also vision care, hearing aids, that might be covered as well. So when I sit down with someone, I'm looking at all of your options, not only a Medicare Advantage, but a supplement plan, and reviewing with them what the differences are. And you've got to find a comfort level, whether you want to be tied to a network of any sort, or whether or not I can go wherever I want. So that's depending on that. And again, your Part A will always be the first of your birthday month. Your Part B, you determine when you want that to go into effect. For most people, you can go to Medicare.gov and sign up for Part B. But if you're currently under an employer plan, you're going to have to provide proof, if you will, that you do have credible coverage. And secondly, that you're leaving the group coverage as of a certain date. Was there a fourth piece to that? I'm trying to...
Person asks, how far in advance of retirement should they start looking at that?
Okay. Well, you can sign up for Part A and Part B 3 months prior to the month that you want your program to go into effect. So if you're looking for a January 1st effective date, for example, 3 months prior to that, you can actually enroll in a Medicare Advantage plan or a supplement plan. You want to give yourself enough time to review all of your options and to make a choice that's going to meet your requirements.
I think you covered all of those. Our next question is, can you clarify between supplemental plan and the vision, prescription, and dental plan?
Sure. Well, a supplement plan is covering the 20% that Medicare does not pick up. Okay, they're either typically a Plan G, there's also a Plan N, and there are some lesser benefit plans as well. In terms of dental, that's the reason why I offer dental plans on a individual basis through other insurance companies, because dental is not picked up by Medicare, nor is vision, unless it's being offered as an additional benefit. Some insurance companies do that, but you're not going to find a supplement plan that offers dental, for example. And with dental, you've got to be very careful, because if you're covered under a group dental plan, you want to make sure that the premiums are going to offset the benefits that are there. And same holds true if you do this on an individual basis. So that's what I help my clients with, to make sure that they understand that.
And then she wanted to know, you mentioned Plan N, and what is that?
Yes, Plan N is very similar to Plan G. Again, Plan G is the highest level of benefits. Under Plan N, it's going to be lower in cost, but it's not going to have 3 specific benefits that you have under Plan G. You're still going to be paying the $198 annual deductible. Anybody who has Plan B, you're going to be paying that, or Part B, I should say. I just forgot my train of thought there. The differences between N and G. First of all, under Plan G, there are no co-pays for going to see a physician. Under Plan N, there is. You may be paying anywhere between $25 to $50 for an office visit. You don't do that under Plan G. There's also an annual deductible for emergency care services that does exist under Plan N. It does not exist under Plan G. So there are savings per month by going with N over G. And in fact, one of the things that I lay out for people in my Medicare analysis, what's the cost difference between G and N on both a monthly basis and an annual basis? And then you can decide whether you think it's going to be worthwhile. One other difference too, I'm sorry. Under Plan G, excess charges are picked up. Providers can charge up to 15% more than what they've agreed to under Medicare. Well, under Plan G, that is covered. It's not covered under Plan N. So that's another difference between the two. But these are the things that I sit down with all my clients to review the different plans. Cost-wise, we'll talk about customer service so that you can make a decision that you're going to feel comfortable with.
We have a question from someone who would like to know, regarding Part D, can you explain the difference between an insurance plan like SilverScript versus GoodRx?
Yeah, absolutely. Well, first of all, GoodRx is not an insurance plan. There are discounts for prescriptions that you may need. A prescription drug plan like Part D, SilverScript, and there's a host of other programs as well. All insurance companies have tier levels for medications. They generally range from tier 1 through tier 5. A tier 1 and a tier 2 are generic. A preferred brand is a tier 3. Non-preferred brand name is a tier 4. And a tier 5 is a specialty drug. So that's how insurance companies are set up for Part D, prescription drug companies. Typically, there's also an annual deductible. Some insurance companies require a separate deductible for the prescription drug coverage, no matter what tier level your medication falls into. Others will only require a deductible if it's a tier 3, 4, or 5 medication. So again, in my analysis, I will break out your medications so that you know what the tier level is with any of the insurance companies that I represent. So you'll have an idea of what it's going to cost you. Because generally there are co-pays for prescription drug medicine. With GoodRx, and I've used that GoodRx myself at times, especially if I'm taking any tier 3 or tier 4 medications. It does work. There's no question about it. It's not going to work for every type of medication, however. So you've got to be careful. But it's easy to use. You go to GoodRx, you put in the name of your medication, the dosage, the frequency, and it'll tell you what your cost would be at any of the local pharmacies. Then you can compare that to what the tier levels are. If you are in a SilverScript program, for example, it may be that SilverScript, it's going to cost you less out of pocket than it would if you did go into GoodRx. And the reverse on that is true as well. So you just need to be careful with that. That's all.
Someone would like to know, is there a delay in Medicare coverage after joining? So if I turn 65 in June, can I have knee replacement surgery in July covered by Medicare?
Well, first of all, if you applied in June, your Part A effective date is going to be June, assuming your birthday's in June. Your birthday is going to be June 1st for Part A. And again, if you can make your Part B effective at the same time. So if you're having surgery, let's say a month later, you're going to be on Medicare. When you submit an application for Medicare, typically it's going to take about 10 to 12 days before you get a verification from Social Security indicating and providing you with a Medicare number and also a confirmation that you have signed up for Part A, or whether or not you haven't signed up for Part B. So it works extremely well. But again, the earlier that you can submit your application to Medicare, also for a supplement plan, again, my recommendation is 3 months prior to the date that you want to leave. Again, you want to have continuous coverage. So if you know your program is going to end at the end of June and you want a July 1st effective date, you want to make sure that everything is set up to gear for that, so that on July 1st, your Medicare coverage is ready to go.
There's a question from someone who says, if you're not satisfied with a supplemental plan, how easy or difficult is it to switch between plans?
That's a great question. Most insurance companies, well, let me go back one step. When you first go into Medicare, there is no questions regarding your health. None whatsoever. But in future years, if you want to make a change, many insurance companies will require you to go through medical underwriting, a series of questions that you're going to have to answer regarding your health, what medications you may be on, and then that's submitted to the insurance company. They then decide whether they're going to approve your application or deny it. Well, if they deny it, you stay where you're at. It's a very simple process, really. And you're always encouraged to make a change. It's just that based on your history, on your medical history, you may not be able to do that. Now, there is one insurance company that has no medical underwriting at any time. And again, I represent that company as well. But their prices are a little bit higher. So those are the trade-offs. In terms of changing your insurance company for a prescription drug plan, it's easy. No medical underwriting whatsoever. If you wanted to change, let's say from 1 to SilverScript, just to give you an example, all you would do is fill out an application. I help people with that. Once it's processed and you get approved, it automatically will cancel out your current prescription drug plan. No questions regarding your health, no questions regarding your medication. The monthly fee that they charge is the same, whether you're taking one medication or whether you're taking 20 medications.
There's a question from somebody who would like to know, if you have both Medicare Part B and a group employee plan, which is the primary insurance if needed. Yeah, I'm trying to read this question. If you have both Medicare Part B and a group insurance plan, which is the primary insurance? Which is the primary insurance if needed?
Okay,
the group
really
is larger than 20 people.
Yeah, if it's larger than 20 people, then Medicare is going to be primary, and your employer coverage should be secondary, unless they've changed that. But that's the way it's structured right now. Some employers require you to have Part A and Part B, even though you're staying on the group plan. Some employers only require that you have Part A, because if you have Part B, you're paying a monthly charge for that. You can't really double dip, if you will, with a Part B and also your employer plan. So those are the questions that you really need to ask your employer so that you can get the story right. And one of the basic questions, will they allow you to keep coverage even after you're age 65? Not all employers do that. So those are the types of questions that you need to converse with your employer about so that you know what directions that you need to go with.
Okay, there's a new question. The person says, I currently have health insurance via the military. Once I turn 65, I have to take Medicare. Is healthcare via the military considered credible insurance coverage?
Yeah, it should be. Again, I don't know exactly what coverage you have, so it's hard for me to answer that. But certainly I would think that it would be. And again, it's one of the things, if you want to talk to me on an individual basis, I'd be happy to go through that to get a better idea of what your benefits are and to see if that would qualify.
Let's see, the person who was asking about the prescription and GoodRx
Yes.
sent a follow-up question, and she says, if I sign up for a GoodRx, will I get penalized later for not signing up for Part D?
Great question again. My kudos to the audience. Here's the way it works. If you do not sign up for Part D, prescription drug coverage, when you are first eligible, and you decide 2 years down the road that, hey, you know what, I really do need a prescription drug coverage, well, then you are going to pay a penalty for the rest of the days that you are covered by Medicare. Because the government is going to look at when were you eligible and when did you actually sign up for Part D. So if to avoid the penalty, I always certainly recommend that people go with an inexpensive program right off the bat. Let's say you're only taking 1 or 2 medications, assuming that they're generic. you're not spending a lot of dollars for it, but you're giving yourself protection so that if your health changes down the road and you need a higher level medication, you have the coverage.
Okay, well, those were our questions that we had from our audience. I think we
Okay.
got through all of them. So, and I think you handled them very well. You know all the
Thank
ins and
you.
outs of this, Mike. Um, I hope you felt everyone found this valuable. Again, I will send you a link. Let's see, there might be one more question here. Oh, sorry, there's a couple more questions filing in. So hang on, we're
Yeah,
not
go
turning
ahead.
out yet. Okay,
Sure.
how long after I turn 65 do I have to get a Medicare supplement?
Okay. Well, when you leave your group coverage, let's say you want to go with the supplement plan, you have 8 months in order to do that in. But again, that goes against having continuous coverage. What are you going to do for the interim? I mean, if you leave January 1st from an employer plan and you don't sign up for a supplement plan until June or July, you're on the hook for that 20% that Medicare does not cover. So that's the thing where you need to do some planning in terms of when do I expect to leave group coverage? When do I want to have my Medicare coverage so that I have continuous coverage, not only for Medicare Part A, Part B, but also for a supplement plan, if that's the way that you want to go, or a Medicare Advantage plan. It works the same way. So you need to give yourself some time. And again, it's recommended at least 3 months prior to when you want to leave an employer plan to go on to Medicare that you make the application. As soon as you have a Part A and Part B set up, then I suggest contact me. I can help you with enrollment into any supplement plan or a Medicare Advantage plan.
Okay, another question. She says, my husband is 67 and is working full time. He is covered under a group plan. He never signed up for Medicare or anything else. Will he be penalized for Part D?
No, not at all. As long as he does it within that 8-month period of time, there would be no penalty because he's leaving group insurance to go on to Medicare or a prescription drug plan. Again, for prescription drug plan, you have to have either Part A or Part B. You don't have to have both for a prescription drug plan.
Okay. Are there any other questions anybody would like to submit before we let Mike go? Let's see, anything else? Okay. I think that is it then. So Mike, thank you very much.
My pleasure. I
And
love doing
it was
this.
a very helpful session. And we'll make sure everybody gets your information. And thank you for joining us.
My pleasure. Thank you. And thank everybody for participating. Great questions.